we have three categories of a medicine. We have an agonist, we have a partial agonist, and we have an antagonist. So you've got three types of medicines. Now, an antagonist is a drug that will bind to that receptor, so that opioid receptor, but when it binds to it, it has no effect at all. It doesn't cause any changes, it doesn't do anything except for block the receptor. So when you give me, I pass out here because I'm having a heart attack, and you guys take that naltrexone and you squirt it up my nose, and it binds on the opioid receptor, nothing happens. It's an antagonist. It doesn't cause any of the signs. It doesn't cause me to have euphoria, doesn't take away my pain, doesn't help me to have pinpoint pupils, doesn't do any of those opioid acts. That's an antagonist. What it does do, because it binds on the receptor, if there's an opioid on it, it's going to fight over that receptor, and when that opioid comes off the receptor, that's what causes those symptoms. So it has no effect on the receptor except for cleaning off the receptor. And when it cleans off the receptor, if you had it on there, then it will put you into withdrawal. But that's not the drug doing that. That's the opioid coming off the receptor doing that. Okay? That's an antagonist. An agonist is most of the medications we see. Codeine, hydrocodone, oxycodone, dilaudid, hydromorphone, heroin, methadone. These are all pure agonists. Let me show them what an agonist looks like, honey.
Remember, this is a family show.
Yeah. This is an agonist. Okay? So, when I do this, we get the effects of what happens when you take an opioid. You get the pure effect of the love for that receptor, and you get everything that comes with it. Okay? So that's what the pure agonists do. Wendy, can I use you for demonstration?
Tammy.
This is a partial agonist. That's a partial agonist. You're only going to get part of that effect. Completely different from what Tammy. So a partial agonist is buprenorphine. That's the medication that we use. And so you get a partial effect on the opioid receptor of these symptoms and not the full effect. So those are the three classifications of medications. Now, me and Bobby Joe, if I give them that partial agonist, okay, stand up again. If this is an opioid, if there's an opioid, no, come here, Tammy, too. Okay, so I've got my pure agonist here, and I got my partial agonist here. Now I'm with the pure agonist, right? But if I see the partial, and I go to do that with her, she's gonna whack me in my head, right? She's gonna whack me in my head, and that's what happens when you mix a partial agonist with a full agonist. They don't like each other. It's oil and vinegar. They don't mix, and so you get bad symptoms. So that's why Bobby, Joe, and myself don't worry so much about our dosing with buprenorphine on a cow skill. Because if you're playing with me and I'm giving you the partial agonist, guess what's going to happen? It will make you sick. And I don't worry about you being sick. I worry about you liking it too much. Now, if I take this pure agonist again, and I've got this one in, and I'm going to add another agonist. Okay, now we've got this synergistic additive effect. Okay, so when we have that, and they've got low withdrawal skills, and I'm going to add that methadone onto that heroin you got on board, we may die.